when staph is present on the skin. And again, anytime there's broken skin, you can probably get some staph sitting on the top. It's releasing those toxins, right? Like alpha toxin and delta toxin. So it's making things that can literally deviate protease that actually causes itch directly. So all these pieces make our skin itchy and uncomfortable. And then of course that can start the scratch itch cycle. People start rubbing it, which is really bad, as you say, mechanically damaging it and fueling this whole fire.
Dr. Leo, it is such an honor yet again to have you back on the Healthy Skin Show. Thank you for being here.
Thank you for having me. It's always a pleasure.
Well, you are one of the fans' favorites because you're so good and so compassionate at sharing with people what these conditions are. And one of these conditions, actually, I have gotten so many requests in our customer support box about, which I was not really familiar with, is something called Stasis Dermatitis. So can you explain to us what exactly that is?
Absolutely. So venous stasis dermatitis, or sometimes called venous stasis eczema, it really is a form of inflammation in the skin that is very much an eczema. There's redness, there's dryness and scaliness. Sometimes if it's very acute, it can be open and oozy. So it is one of the eczemas, but it generally is affecting the lower legs where there is venous insufficiency, where the blood return is not able to do its job. And there are a number of reasons for that, which we can talk about in a minute. But when the blood is sort of pooling in that area, now it turns out it doesn't have to just be the legs. For people, for example, if they're bedridden, it might be the lower back and the buttock area. Sometimes if people have kind of a larger belly and it's hanging over, sometimes we can actually see stasis eczema or stasis dermatitis at the bottom of their belly because the same process is happening. The blood is pooling in that extra tissue.
Oh, wow. And when you say venous, just for everybody who's listening, you mean the veins, correct?
Exactly. Right. So our circulatory system, the arteries bring the fresh oxygenated blood to the tissue. The veins bring it back to the heart so it can get reoxygenated. And the veins are a little looser. They're a little softer, right? They're not under pressure where your heart pumps that blood arterial. So that gets it to the place. But sometimes it has to kind of rely on different aspects of muscle, and the veins actually have little valves in there that prevent it from backflowing. But if the veins are damaged, or if you have a heart issue, or if you already have had the veins stretched out for some reason and swelling in the area, then the blood can pool. And when that happens, different factors kind of leak out of the blood, inflammatory cells and different things. I don't think we even fully understand it, but it causes the secondary inflammation in the skin. And basically, I always say to the patients, when they're swelling, your skin really doesn't like this. So we have to get rid of the swelling so your skin can heal.
Now, are you typically the first person or physician who would diagnose this, or is this sometimes caught by other doctors? Because obviously it has to do with your veins and your cardiovascular system. So how would this get diagnosed? And is this something that you tend to see? And is it a warning sign?
It definitely can be a warning sign. I would say we see it a fair amount. Probably the cardiologists see it the most. Many patients with a known heart issue, if they either have a problem where they're not pumping their blood at maximum efficiency, they are going to have some amount of venous insufficiency where the blood is pooling back in the legs. And I imagine if you go to any cardiology office, you'll see a lot of the patients, their legs are swollen, and many of them may have stasis derm. We see a lot of them once it becomes symptomatic because, and I've written actually a paper about this many years ago, it looks really confusing. If you don't know what this is, then it's confusing. You see redness and swelling and it's tender. So people often assume it's an infection. And I'll tell you a story I had years ago. I was still in training. I had a patient, a very nice lady who had a history of some heart issues and would get terrible swelling of her legs. And then they would turn red and tender and swollen if she had venous stasis dermatitis. But every time she'd go to her primary doctor, they'd say, uh-oh, it looks like you have an infection. You've got cellulitis. So they'd put her on oral antibiotics. And of course, it wouldn't get better because it's not an infection. And they say, you got to go into the hospital. So this patient finally got sent to dermatology. I'm not exaggerating. She had 11 hospital admissions, 11 times. And each time, she'd go in the hospital, they'd put her on IV intravenous antibiotics for days and all this stuff. And she said they took great care of me, but then I'd get a bit better and go home. And then I said, she said, well, why would it help if it wasn't an infection? I said, well, tell me something else you do when you're in the hospital. She's like, well, nothing. I just laid in bed all day. And I said, exactly. You put your feet up. You weren't. And she said, oh my goodness, you're right. Because when I'm in my wheelchair, they're just dangling all day long. I'm seated this way. And that was the moment. So once we were able to help her, then she never got hospitalized again in the several years that I took care of her after.
Wow. So who is most at risk for this? Is this like something that you would see in children, or is it
Almost never in kids. Generally, these are going to be older patients, although you can see it in, sometimes young adults. But the truth is, usually it's people that have a history of some issue with their heart or with fluid retention, or if they actually have a vein problem. So people with big varicose veins, that can be a family issue where the veins are, again, not working properly, or the venous valves are actually not doing their job of keeping the blood from backflowing. Those are the people we usually see it in.
This episode is brought to you by my line of professional-grade supplements called NutriQuel. I crafted these supplements especially for those struggling with chronic skin rash issues and base the formulations on my extensive research and clinical experience in my private practice. They are made from the highest quality ingredients and tested to be free of different allergens so that you can support your gut, liver, and overall health with the formulas that I've found work best for my skin rash warrior clients without triggering a flare. I'm excited to share them with you, so check them out at quellshop.com and use the coupon code GET15OFF to get 15% off your first order. I'll put a link in the description below, and now let's jump back to the video.
Okay, so I have to ask, because I literally have thought until this point that varicose veins were like a harmless thing. Maybe they get unsightly the more pronounced they are, but am I mistaken in thinking that they could be a red flag for issues?
I think generally speaking, in the world, varicose veins are very common and they're usually fine. The people that have them are healthy and they're fine. But if they get bad enough, not only can they be symptomatic and sore, but they really can be the sign that there is something problematic, that the veins are not doing their job. That blood, literally the blood is pooling. That's what you're seeing. That varicosity is a swelling of the vein. So it is abnormal to some degree. And it, again, most of the time is probably fine. But if you do have it, especially if it's on one leg or if it's a sudden thing, that really can be the sign of another reason. So we talked about heart issues or vein issues, but another thing that can happen is a blood clot. If you have a blood clot in your leg, then, or even a little bit higher, if it's pushing up towards your pelvis or abdomen, that can actually, again, cause the blood not to be able to flow. It's blocked off, and then you get backflow, and then you can get stasis eczema or stasis dermatitis in one leg. And that's another scary thing. So there are reasons that if this happens quickly, it's kind of a big deal. If it's happening slowly, it's probably not dangerous, but it is a problem, and it's something we want to make sure we address.
So this is reminding me of a man who was a patient of my dad's many, many years, probably 15, 20 years ago. And his lower legs were like purple. They were like purple in color and looked so swollen and whatnot. And I had asked him if he, had seen the doctor for that, because obviously it did not look appropriate. And I was just trying to double check, are you getting certain things checked? And I know that he was diabetic. I do remember that. He had told me that. And now this is making me think that maybe this is, maybe this was an issue for that man, because I would imagine when your legs become discolored, so obviously if it's more whitish, like a paler toned skin, it may look like reddish, purplish, but in other skin tones, is it possible that this might look a little different?
Absolutely. If there's a lot of melanin in the skin, more richly pigmented skin, you might have trouble seeing the redness. It might actually just look a little darker. Sometimes erythema redness can look just more like darker skin, so it can be confusing. And of course, another piece is that when you get inflammation, we know that we get that pigmentation that comes after post-inflammatory hyperpigmentation. So that's the other piece. People that have recurrent stasis eczema or dermatitis, they'll often have dark brown patches on their legs, and that can be a sign. Even in between flare-ups, they'll say, "What do you think is going on? Do you, trust me, please believe me, I really do get redness." I'm like, I believe you. I see the leftover. I see the pigmentation. So I know that you're getting inflammation. So we have to talk about that.
So one thing, as I was reading about this, because I was not really familiar with this concept of venous hypertension, so this high pressure in the veins, that this can cause some really serious issues, which obviously impact I mean, it can lead to amputation. It can be very serious. I read about, it can cause cellulitis. It can cause ulcers on the leg. Can you talk a little bit about why that would happen? I just want people to take this seriously because I think this could be something that you might say, oh, well, I'm older. I don't walk around as much. I don't move as much. And we just sort of sometimes assume that some of these things are normal because of aging. But this kind of sounds like something that you should see a doctor about.
Absolutely. I mean, you're right. Many people, especially as we get older, if you're standing a lot, let's say you work you're at a cashier at a counter all day, it is not crazy to have a little bit of swelling on your legs at the end of the day. Or a surgeon who's doing a 12-hour case. When we were doing that as medical students, your legs would be a bit swollen. In fact, many people who work in operating rooms or are on their feet all day, they will wear compression stockings, those really tight stockings you have to pull on to keep their pressure up on their lower legs. It's really helpful. Actually, it can make you feel a lot better, make your feet and legs feel better. So a lot of people who stand for their jobs will wear compression stockings. And that, of course, is one of the treatments that we do for venous stasis dermatitis as well. Now, if you develop it quickly, though, that's when I get worried. It's like all of a sudden you're getting swelling in your legs, and it can be very serious. And of course, left untreated, as you say, it can lead to really bad swelling, redness, open sores, deep ulcers that can be very difficult to heal. And even though the patient I described, it was not really cellulitis infection, it was kind of mimicking it. It looked like cellulitis, but it absolutely can become true cellulitis because the blood flows bad and the skin barrier is damaged. So you really can open the door. And then you can imagine if you get an infection in an area of skin that has swelling and slow blood flow and then you can be in big, big trouble. And so we don't want to mess around with that. That's why it's so important to prevent it and not be reactive every time.
Yeah. And so for those who don't know what cellulitis is, what is that?
Cellulitis literally just means the soft tissue or skin infection. It's typically caused by staph or strep, those two common bad guy bacterias. And that's like maybe a good story would be somebody cut their leg when they were out in the woods. They got a scrape and then it got a little red around it. And then all of a sudden there's a big red patch and it's sore. And when they touch it, it hurts them. And now they're getting a fever. They say, oh, you have cellulitis. You now have an infection of your skin. It's not something we can just put a little topical antibacterial on. Now you need either an oral antibiotic or you're going to need an intravenous antibiotic to help fight this infection. And that's the kind of thing left untreated. Eventually it can go into your blood. It can keep creeping up. It climbs up your lymphatic system and you can get in serious trouble. So cellulitis is a serious infection.
And one thing about this, I mean, this would probably make sense, is that they can, well, at least I read, that this stasis dermatitis can be quite itchy. And you've talked about how when we mechanically damage the skin, you don't mean to do that, but you're scratching because it's so itchy. Obviously, that can introduce bacteria. So do you know why this could be an itchy condition?
Absolutely. I mean, it really does fit at home in the eczemas, right? So we know our eczemas are complicated. They really refer to this concept where there is inflammation and all these inflammatory mediators. And we know some of the characters now, IL-4, IL-13, IL-31, which is the master itch cytokine. So there are receptors on our nerve endings. When you release certain kinds of inflammation, literally we interpret that as itchy. So it's driving itch. But then once the barrier is damaged, we have bacteria overgrowing, we have allergens and irritants, things bothering the skin, and our immune system reacts even more to that. We know that when staph is present on the skin, and again, anytime there's broken skin, you can probably get some staph sitting on the top. It's releasing those toxins, right? Like alpha toxin and delta toxin. So it's making things that can literally, the V8 protease that actually causes itch directly. So all these pieces make our skin itchy and uncomfortable. And then of course that can start the scratch itch cycle. People start rubbing it, which is really bad, as you say, mechanically damaging it and fueling this whole fire.
So if someone does get this diagnosis of the stasis dermatitis, I just want them to hear this. It sounds like they should go see a cardiologist in addition. Like you should investigate this in some regard.
If it's new onset, what I'd say is this: we'd start with our primary care doctor. Most primary care doctors are really good at knowing what to do, and we'll figure out if do we need to do an ultrasound to check to see what's going on with the blood vessels? Do we need to check for a blood clot if it's new? Do we need to ask what's going on with your heart? Why is your heart? Is it not effectively pumping? Is there a problem with that we need to look at? So then they might refer you to a cardiologist. I think it's tough for most people just to go find a cardiologist straight up, but starting with primary care and just saying, hey, can we talk about this? This seems new or worsening to me. So that's step one. And then step two, if they're still having trouble, most of the time, as I say, I would argue the vast majority of time, they're going to say, yeah, it's just a little bit of venous stasis. It happens. But if they're still getting this irritation, itch, then it's time to come see us. It's time to come see dermatology. And I'll say, okay, now we'll talk about some of the things we can do to help prevent the inflammation and minimize this. Truth be told, the only person who can really fix it, if there's such a thing, would be the person like a cardiologist if it's a heart problem, or like a vascular surgeon if it's a vein problem. If the veins are really damaged for some reason, then we might need a vein surgeon, a vascular surgeon to go in there and either do the surgery or do sclerotherapy or laser therapy. They can actually put a laser into the blood vessels, into varicose veins, and zap them. So they have all these tools. It's outside of my ken, but I would refer and say, you need to see a vascular surgeon who will help us here, which is really important.
Wow. So for someone who's coming to see you who has this, you mentioned the compression socks. Is there anything else that you can do or you suggest for somebody who has this?
Yes, we have lots of little tricks. So compression stockings are great. The problem is, first of all, for older people, it's very tough to put them on. Like it is, I mean, even for younger people, and I'm not that young anymore, but even when I was like in my 20s, I remember I tried it. In med school, they said, try, see what you think, see if you can do this. And we were all like on the floor pulling and grunting, and it's really hard, especially if you wear the appropriate. Now, sometimes you can buy like a very low level of, they measure it in millimeters of mercury, the pressure. If you get a very low one, then it's not much harder than putting on a sock. But to get what you really want, this kind of clinical compression level, then it is difficult to put on and off. So sometimes the older folks need someone to help them if they have trouble bending or moving or weaker hand strength. So that's one issue. The other problem is that they can be uncomfortable. They're hot and they can be itchy sometimes. So people are like, I hate wearing them. So one of the things that we'll do, especially if it's very acute, you really can. If there's sores and stuff, you don't want to put this on somebody. It's difficult. So what we'll do in the short term is we'll actually do something called an Una boot. And an Una boot's one of my favorite techniques, and we use them for a lot of things, but this is one of the best things they're for. So what it is, and you can actually purchase them over the counter. All it is a gauze roll that is impregnated with zinc oxide and also typically with sort of an iron oxide and calamine lotion type thing. But usually we get the colorless one, the modified Una boot that's just zinc oxide. So it's diaper paste on gauze, but it's done in a way that it's kind of hard to do this at home. And it's not very expensive. They're just a few dollars per roll. And what we do is we clean the leg really well. We might put on like a cortisone or a non-cortisone anti-inflammatory medicine, or if we didn't want to do that, we could just use like a moisturizer, and then we'd wrap that leg with the Una boot, not too tight, we're sort of gently wrapping, but we'd start a little tighter at the ankle, a little looser. So we kind of make a gradient of pressure. And then it's cold and damp and zinc oxide. It's white diaper pasty, or if we use the old fashioned one that also has the calamine, so it's pink. And then we put like another wrap, like an ace wrap, or if they don't want to do that, they can just put like a sweat pant over it. And then they wear that for up to a few days. You can even do it for several days. Usually I have people sleep with it, and then I had them replace it the next day, come back in, or in a day or two, and we'll do that for a few days in a row, and it is the most dramatic thing you've ever seen in your entire life. An Una boot wrap, because it gets rid of the extra fluid. It protects and heals the skin. If you use it with a medicine, it pushes the medicine in. So people come in looking terrible, and like 3 days later for the change, they're like, it's a miracle. It's brand new. It's so powerful.
Well, it's also interesting because you're helping to move the fluid out of the leg and you're aiding the circulatory system. So I'm sure there's a lot of different things happening at the same time. Would you also say, like, if someone could be more mobile, like to try to walk and not be stationary?
Absolutely. Taking walks is really important because that's a lot of the way that our blood vessels work. The veins require the muscular movement. So taking walks regularly, you don't have to be super long. You don't have to hike up a mountain. But even if your mobility is limited, doing the best you can, elevating those legs when you're sitting. If you can't get them above your heart, we say get them higher up than your heart or your chest. That really will help you. Also, we know that not standing for long periods in the same position. So if somebody's at a job where they have to stand, sometimes we'll write a note. Can they please sit for part of it, or can they move around for part of it? Can they do something to break that monotony? Because otherwise it really can be made worse.
Wow. Well, thank you very much for clarifying this. And I hope that everybody who hears this, who's been writing in and asking me questions, this is really helpful. Like I said, this is not something that I had any experience with. And I honestly didn't even know that you could have hypertension in the veins. So this has been, even for me, this has been very enlightening. And it's a part of your body that we don't tend to think about. We think about the heart, we think about our arteries, but we don't think about what's bringing all that well, our blood that's deoxygenated and all of the waste back on up to do all the things we need to do, and how that could then impact the skin. So thank you so much for sharing all of that.
It's my pleasure. Thank you for having me.
If you enjoyed this video, you need to tune in to this video next. Then make sure to hit the subscribe button so you get notified as soon as a new episode drops. I'm excited to see you there and dive deeper with you on your skin healing journey.